Living with Heart Failure, a comprehensive guide. Introduction: Unveiling Heart Failure. On the U.S. Health Guide, we're committed to bringing you vital health information. Today, we tackle the complexities of heart failure, offering a comprehensive guide to living well with this condition. The term heart failure often conjures images of a heart that has completely ceased to function, a misconception that can cause unnecessary alarm. In reality, heart failure, HF, describes a condition where the heart cannot pump blood as effectively as it should to meet the body's metabolic demands. This diminished pumping action means the body may not receive enough oxygen and nutrients, leading to a variety of symptoms. While heart failure is a serious and often lifelong condition for which there is currently no cure, it is crucial to understand that it can be effectively managed through appropriate medications and healthy lifestyle choices, enabling many individuals to lead full and enjoyable lives. A healthy heart operates as a highly efficient pump, with its 4 chambers beating in a synchronized and organized manner. Deoxygenated blood from the body enters the right atrium, passes through the right ventricle, and is then pumped to the lungs to receive oxygen. Once oxygenated, this rich blood returns to the left atrium, moves into the left ventricle, and is subsequently propelled to the rest of the body, supplying all tissues with essential oxygen and nutrients. When the heart begins to weaken or struggle with its work, the body's intricate systems initiate compensatory mechanisms in an attempt to maintain adequate blood flow. Initially, the heart may enlarge or develop additional muscle mass, allowing it to contract more forcefully. It may also pump faster to increase blood output. Concurrently, blood vessels may narrow to help maintain blood pressure, and the kidneys might retain more salt and water, increasing blood volume. These physiological adjustments are short-term solutions designed to mask the underlying decline in heart function. This compensatory ability of the body to a weakening heart means the condition can progress silently for years without obvious symptoms. The initial effectiveness of these compensatory processes can delay the recognition of heart failure, making regular checkups particularly important for early detection before these mechanisms become overwhelmed and symptoms become pronounced. The root of the problem: causes and risk factors. Heart failure stems from various conditions that damage or weaken the heart muscle, impairing its ability to pump blood effectively. The most common underlying cause is coronary artery disease, CAD. In CAD, fatty deposits known as plaque build up inside the arteries supplying blood to the heart muscle, leading to arterial narrowing. This atherosclerosis reduces blood flow, forcing the heart to work harder. A heart attack, which occurs when a coronary artery becomes completely blocked, causes sudden and often irreversible damage to the heart muscle, directly contributing to heart failure. Another significant contributing factor is high blood pressure, or hypertension. Uncontrolled high blood pressure forces the heart to exert excessive effort to circulate blood throughout the body. Over time, this sustained increased workload can cause the heart muscle to become stiff or weakened, diminishing its pumping efficiency. Beyond these primary causes, several other conditions and lifestyle factors can lead to or exacerbate heart failure. Heart valve disease, where valves are narrowed, stenosis, or allow blood to flow backward, regurgitation, forces the heart to work harder, eventually weakening it. Treating certain types of heart valve disease can sometimes reverse heart failure. Cardiomyopathy, a disease directly affecting the heart muscle, directly reduces its pumping ability. Irregular heartbeats, or arrhythmias, can also impair the heart's pumping efficiency. Structural heart problems present from birth, known as congenital heart defects, can strain the heart over time. Infections such as myocarditis, inflammation of the heart muscle, often caused by viruses including the COVID virus or rheumatic fever, can cause heart damage and subsequent heart failure. Several systemic conditions and detrimental lifestyle choices significantly increase the risk of developing heart failure. Diabetes is a known risk factor, increasing the likelihood of heart disease and heart failure. Obesity, characterized by excess weight, is not only an independent risk factor, but also amplifies the negative impact of other cardiovascular risk factors, such as high blood pressure and diabetes. This interconnectedness among risk factors means that managing one can yield benefits for others. For instance, addressing obesity can improve blood pressure and diabetes control, illustrating the importance of a holistic approach to prevention and management. Harmful lifestyle choices also play a significant role. Smoking and other forms of tobacco use severely damage arteries and significantly increase the risk of heart attacks. Unhealthy diets, particularly those high in fat, salt, sugar, and cholesterol, are strongly linked to heart disease. A lack of regular physical activity and chronic emotional stress can also contribute to heart disease and worsen existing risk factors. Poor dental health can facilitate the entry of germs into the bloodstream, potentially leading to infections like endocarditis that affect the heart. Furthermore, exposure to certain medications such as some chemotherapy agents or the use of toxic substances like alcohol and recreational drugs, example, cocaine, methamphetamine, can increase the risk of heart failure. Unmodifiable risk factors include increasing age, which raises the risk of damaged arteries and a weakened heart muscle, and a family history of heart disease, especially if a parent developed it at an early age. Listening to your body, recognizing symptoms. The manifestations of heart failure can vary significantly among individuals, sometimes appearing suddenly and at other times developing gradually over an extended period. Common symptoms reflect the heart's inability to pump blood adequately and the subsequent fluid accumulation in the body. One of the most frequent symptoms is shortness of breath, which can occur during physical activity, at rest, or particularly when lying flat, a condition known as orthopnea. This often leads to individuals waking up at night, gasping for air. This symptom primarily arises due to fluid buildup in the lungs, a condition called pulmonary edema. Fatigue and general weakness are also common, as the weakened heart struggles to deliver enough oxygen-rich blood to meet the body's energy demands. Everyday activities such as walking, climbing stairs, or carrying groceries can become extremely difficult. Fluid retention or edema is another characteristic symptom, often manifesting as swelling in the legs, ankles, feet, or abdomen. This fluid accumulation can also present as rapid and unexplained weight gain, which is a critical indicator of worsening heart failure. A persistent cough or wheezing may also be present. This cough can be dry and hacking, or in more severe cases, it may produce white or pink foamy mucus, indicating fluid in the lungs. The heart may also try to compensate for reduced pumping efficiency by beating faster or irregularly, leading to sensations of a rapid or irregular heartbeat or palpitations. Other symptoms include a reduced ability to exercise, nausea and lack of appetite due to fluid buildup in the abdominal area, difficulty concentrating or decreased alertness due to reduced blood flow to the brain, and an increased need to urinate frequently at night, nocturia. Understanding the progression of these symptoms is crucial. The severity of symptoms can indicate the stage of heart failure, and changes in these symptoms serve as a vital warning system. For instance, while new shortness of breath with activity might be a concern, shortness of breath at rest or a rapid weight gain of pounds in a day or pounds in a week signals a more urgent situation. This emphasis on monitoring symptom changes empowers individuals to proactively track their condition and seek timely medical attention, potentially preventing more severe complications or hospitalization. It is imperative to recognize when symptoms demand immediate medical attention. Individuals should call emergency services if they experience any of the following: sudden, severe shortness of breath, especially if accompanied by coughing up white or pink foamy mucus, chest pain, fainting or severe weakness, or a rapid or irregular heartbeat combined with shortness of breath, chest pain, or fainting. A sudden weight gain of more than pounds in a day or pounds in a week also warrants immediate contact with a healthcare provider. The diagnostic journey: how heart failure is identified. The diagnostic process for heart failure typically begins with a comprehensive medical evaluation. A healthcare professional will take a detailed medical history, inquiring about personal and family medical history, particularly any cardiovascular issues, lifestyle habits such as smoking and exercise, and all current medications, including prescriptions, over-the-counter drugs, and supplements. A thorough physical examination will also be conducted, focusing on signs and symptoms such as shortness of breath, persistent cough or wheezing, excess fluid buildup, edema, unusual fatigue, lack of appetite, or an increased heart rate. Following the initial assessment, a series of diagnostic tests are often ordered to gain deeper insights into the heart structure and function, and to confirm a heart failure diagnosis. Blood tests are crucial for evaluating various physiological markers. Natriuretic peptides, specifically B-type natriuretic peptide, BNP, and NT-proBNP, are key indicators for diagnosing heart failure and determining its severity, with elevated levels suggesting increased stress on the heart. Other blood tests measure electrolytes, sodium, potassium, and creatinine to assess kidney function, as heart failure can impact renal health. Albumin levels may also be checked as an indicator of nutritional status and liver function. A chest X-ray provides a visual image of the heart's size and shape and can detect fluid buildup in the lungs, a common sign of heart failure. An electrocardiogram, EKG, a painless procedure, records the heart's electrical activity. It can reveal if an individual has had a previous heart attack, if the left ventricle, the heart's main pumping chamber, is thickened or enlarged, and if there are any abnormal heart rhythms, such as atrial fibrillation. It also provides information on the strength and timing of the heartbeat. Echocardiography, echo, considered a primary diagnostic tool for heart failure, uses sound waves to create real-time, moving images of the heart. This test is invaluable for assessing the thickness of the heart muscle, evaluating how effectively the heart pumps blood, measured as ejection fraction, determining the overall size and shape of the heart, and examining the condition and function of the 4 heart valves. An exercise stress test measures how well the heart performs under exertion. This typically involves walking on a treadmill or cycling on a stationary bike while connected to heart monitoring equipment. This helps assess the heart's response to activity and can reveal problems not apparent at rest. It may be combined with imaging tests such as an echocardiogram or cardiac MRI. Other imaging tests include a radionuclide ventriculography or multiple gated acquisition (MUGA) scan, which captures multiple images of the heart over time to create a detailed film of its pumping cycles, offering insights into its overall function. Cardiac catheterization, an invasive procedure, can identify blockages in the coronary arteries, a common cause of heart failure. Cardiac magnetic resonance imaging, MRI, is a non-invasive test that uses powerful magnetic fields and radio waves to create highly detailed images of the heart's structures without using radiation. These diagnostic tools serve a purpose beyond merely confirming the presence of heart failure. The information gleaned from these tests is critical for guiding treatment decisions and for understanding the likely trajectory of the disease. For example, the ejection fraction measured by echocardiography helps differentiate between types of heart failure, e.g., heart failure with reduced versus preserved ejection fraction, and directly influences medication choices. Similarly, EKG findings can indicate the need for specific rhythm management strategies or device implantation. Natriuretic peptide levels not only aid in diagnosis, but also serve as indicators of disease severity, helping healthcare providers monitor treatment effectiveness over time. This comprehensive diagnostic approach ensures that heart failure management is dynamic, allowing for continuous monitoring of disease progression and adjustment of the care plan to optimize patient outcomes. Understanding the progression, the stages of heart failure. Heart failure is recognized as a progressive condition, meaning it can worsen over time. To standardize diagnosis and guide treatment, the American Heart Association and American College of Cardiology, ACC-AHA, have established a 4-stage classification system. Stages A, B, C, and D. This staging system is invaluable for healthcare professionals in understanding the disease's trajectory and tailoring interventions to an individual's specific needs. Stage A, or at risk for heart failure, applies to individuals who have significant risk factors for heart failure but currently exhibit no symptoms and have no identified structural or functional abnormalities of the heart. Key risk factors at this stage include hypertension, diabetes, coronary artery disease, metabolic syndrome, a family history of cardiomyopathy, a history of excessive alcohol use, or exposure to cardiotoxic medications such as certain chemotherapy agents. The primary management focus for Stage A is aggressive lifestyle modification to control these risk factors. This involves careful management of blood pressure, blood sugar, and cholesterol levels, adopting a heart-healthy diet, engaging in regular physical activity, and completely avoiding smoking or excessive alcohol consumption. Individuals in Stage B, or pre-heart failure, have evidence of structural or functional heart abnormalities, such as valve problems, thickening of the heart walls, or reduced ejection fraction. But they have never experienced heart failure symptoms. The management approach at this stage continues to emphasize aggressive risk factor modification. Additionally, certain medications may be introduced, particularly for those with reduced ejection fraction or a history of heart attack. These might include angiotensin-converting enzyme, ACE, inhibitors, or angiotensin receptor blockers, ARBs, and beta blockers, which help protect the heart from further damage. Stage C, or symptomatic heart failure, aligns with what is commonly understood as congestive heart failure. Individuals with Stage C heart failure have a definitive diagnosis and are currently experiencing or have previously experienced symptoms such as fatigue, shortness of breath, or edema. Treatment for Stage C involves a comprehensive approach combining ongoing lifestyle changes with a regimen of multiple medications designed to manage symptoms, improve heart function, and prevent disease progression. Stage D, or advanced heart failure, end stage, represents the most severe form of heart failure. Patients in Stage D experience significant symptoms that profoundly impact their daily lives, often leading to frequent hospitalizations despite optimal medical treatment. At this advanced stage, the focus shifts to advanced therapies, which may include mechanical circulatory support devices like left ventricular assist devices, LVADs, or, in suitable cases, heart transplantation. Palliative care also becomes a crucial component, aiming to manage symptoms and enhance the individual's quality of life. Life expectancy is significantly reduced in patients with Stage D heart failure. The progression of heart failure from one stage to the next varies greatly and is often unpredictable. Some individuals may remain in Stage A indefinitely, while others may progress rapidly or over many years. This staging system serves as a proactive roadmap for intervention. It allows healthcare providers to identify at-risk individuals before symptoms appear, stages A and B, enabling preventive measures. This proactive approach shifts the focus from merely reacting to symptoms to actively altering the disease's course. For patients, understanding these stages can empower them to take early action, adhere to lifestyle changes, and comprehend the rationale behind their treatment plan, ultimately aiming to slow progression and improve long-term outcomes. Effective management, lifestyle, and medication. Effective heart failure management relies on a dual approach, significant lifestyle modifications, and a carefully tailored medication regimen. These strategies are often implemented together, sometimes as part of a comprehensive cardiac rehabilitation plan. Lifestyle adjustments form the cornerstone of heart failure management, providing a critical foundation for improving cardiovascular health. Adopting a heart-healthy diet is paramount. This involves consuming a variety of fruits, vegetables, and whole grains, along with lean meats and fish. A crucial component is limiting sodium, salt intake, as excess salt can exacerbate fluid retention and edema. Healthcare providers often recommend reducing sodium intake to milligrams or less per day, Flavoring food with herbs and spices instead of salt is a helpful strategy. In some cases, restricting daily fluid intake may also be necessary to manage fluid retention. Regular, gentle physical activity is generally safe and highly beneficial for most individuals with heart failure. Rather than needing to take it easy, which can lead to a weaker body, consistent exercise can significantly reduce daily symptoms, lower heart rate and blood pressure, and even help prevent sudden deterioration. It is essential to consult a healthcare professional to develop a personalized and safe exercise program. Consistent self-monitoring is a powerful tool. Regularly checking blood pressure and reporting any unusual readings to the doctor is crucial. Daily weight monitoring is particularly important. A sudden weight gain of -pounds in a day or pounds in a week can indicate excess fluid buildup and worsening heart failure, necessitating immediate contact with a healthcare provider. Effectively controlling other health conditions, such as high blood pressure, high cholesterol, and diabetes, is vital as they can exacerbate heart failure. Staying up to date on recommended vaccinations, including flu, pneumococcal, and COVID vaccines, helps prevent infections that could place additional stress on the heart. Avoiding harmful substances is also critical. Quitting smoking and avoiding all tobacco products is paramount, as tobacco damages arteries and increases heart attack risk. Limiting or avoiding alcohol consumption is also recommended, as heavy drinking can raise blood pressure and weaken the heart muscle, leading to alcoholic cardiomyopathy. Managing emotional stress is crucial, as it can worsen other heart disease risk factors. Prioritizing adequate, quality sleep is also essential, and treating sleep disorders like sleep apnea can improve heart failure symptoms. A range of medications are prescribed, often in combination, to manage heart failure. These drugs work through various mechanisms to alleviate symptoms, improve heart function, and prolong life. Diuretics, often called water pills, help the body eliminate excess fluid and sodium through increased urination. This reduces fluid buildup in the lungs and edema in the extremities, thereby lessening the burden on the heart. Common examples include furosemide, bumetanide, and torsemide. Angiotensin-converting enzyme (ACE) inhibitors and angiotensin receptor blockers (ARBs) are classes of drugs that relax blood vessels, thereby lowering blood pressure and reducing the heart's pumping effort. This action helps prevent the progression of heart failure. It is important to note that ACE inhibitors and ARBs are generally not taken together. Beta blockers slow the heart rate and reduce the force of each heartbeat, helping the heart pump blood more efficiently. They are crucial in preventing long-term heart failure from worsening. Aldosterone antagonists, also known as mineralocorticoid receptor antagonists, MRAs, are a type of diuretic that helps lower high blood pressure and remove excess fluid. They are beneficial for both left-sided and right-sided heart failure. Examples include spironolactone and eplerenone. SGLT inhibitors, initially developed for diabetes management, are newer medications, such as empagliflozin, that have demonstrated significant benefits in heart failure. They act on the kidneys to promote the excretion of sugar, sodium, and water, reducing arterial stiffness and improving heart function, leading to reduced hospitalizations. Neprilysin inhibitors, often combined with ARBs, work by blocking an enzyme that breaks down beneficial natural substances in the body. By doing so, they enhance the effects of these substances, leading to better blood vessel dilation, reduced sodium retention, and decreased strain on the heart. Vasodilators, such as hydralazine and isosorbide dinitrate, directly widen blood vessels, facilitating easier blood flow and reducing the heart's workload. Digoxin enhances the heart's contractions, allowing it to pump more blood. It is typically reserved for more severe cases of heart failure when other medications have not sufficiently improved symptoms. Other ancillary medications may also be prescribed depending on individual needs, such as potassium and magnesium supplements to counteract mineral loss from diuretics, anticoagulants, blood thinners to prevent blood clots, especially in conditions like atrial fibrillation, cholesterol-lowering drugs, statins for high cholesterol, or oxygen therapy to improve shortness of breath. The efficacy of heart failure management lies in the powerful synergy between lifestyle modifications and medication. Lifestyle adjustments address underlying risk factors and establish a healthy physiological environment, while medications directly counteract specific pathological mechanisms of heart failure progression. For example, drugs like ACE inhibitors and beta blockers work by switching off the body's emergency hormone systems that, while beneficial in acute stress, become detrimental in chronic heart failure by continuously overworking the heart. This combined approach underscores that patients have significant agency in managing their condition. Adherence to both components is paramount for symptom improvement, preventing hospitalizations and enhancing overall outcomes. Advanced interventions when more support is needed. For some individuals with moderate to severe heart failure or those with specific electrical abnormalities of the heart, conventional medications and lifestyle changes may not be sufficient. In such cases, advanced interventional therapies, including implantable devices and mechanical support systems, offer significant benefits, substantially improving quality of life and prolonging survival. Device therapies include implantable cardioverter defibrillators, ICDs, and cardiac resynchronization therapy, CRT. An ICD is a small, battery-powered device surgically implanted in the chest. Its primary function is to continuously monitor heart rhythm and detect dangerous irregular heartbeats, known as arrhythmias. Upon detecting such an arrhythmia, the ICD delivers an electric shock to restore a normal heart rhythm, effectively preventing sudden cardiac arrest. ICDs are particularly recommended for individuals at high risk of life-threatening arrhythmias, often due to a weakened heart muscle. While the shock can be painful, it is a life-saving intervention. CRT is a specialized treatment for certain heart failure patients aimed at improving the heart's pumping efficiency. It utilizes a biventricular pacemaker or cardiac resynchronization device that sends precisely timed electrical signals to the heart's lower chambers, ventricles. This synchronized pacing helps the ventricles contract simultaneously and more effectively, enabling the heart to pump blood more efficiently to the body. CRT can significantly reduce symptoms like shortness of breath, enhance overall quality of life, and decrease the likelihood of heart failure-related hospitalizations. Some CRT devices are combined with an ICD, known as CRT-D, to provide both resynchronization and defibrillation capabilities. CRT is typically considered for individuals with heart failure who also have specific irregular heart signaling patterns, such as left bundle branch block. For patients with advanced heart failure, where the heart's pumping function is severely compromised, a left ventricular assist device, LVAD, can be a transformative intervention. An LVAD is a battery-operated pump surgically implanted that takes over or assists the work of the heart's left ventricle, ensuring that oxygenated blood is effectively pumped to the rest of the body. LVADs serve several critical purposes. The device can temporarily support heart function while a patient awaits a suitable donor heart for transplantation, known as a bridge to transplant. In cases of temporary heart failure, an LVAD may be used until the heart muscle recovers sufficiently to pump on its own, referred to as a bridge to recovery. For those ineligible for heart transplantation due to age or other factors, an LVAD can serve as a permanent solution, significantly improving quality of life and prolonging survival, known as destination therapy. LVADs can dramatically improve symptoms like shortness of breath, enabling patients to perform daily activities such as bathing and shopping, and allowing them to enjoy time with family, leading to a substantial improvement in overall quality of life. However, LVAD implantation is a major open-heart surgery with inherent risks, including bleeding, blood clot formation, which can lead to stroke, and infection. Living with an LVAD requires meticulous daily management, including always wearing the external control system, ensuring batteries are charged, and careful wound care at the driveline exit site. Heart transplantation is the ultimate treatment option for individuals with severe, end-stage heart failure that has not responded adequately to other medical or surgical therapies. For carefully selected patients who are fit enough to undergo the demanding surgery, a heart transplant is generally considered the most effective treatment, offering the prospect of significantly longer survival and a dramatically improved quality of life compared to living with advanced heart failure. The continuous evolution of advanced therapies, including sophisticated valve interventional technologies like transcatheter aortic valve replacement, TAVR, and the diverse applications of LVADs, indicates a dynamic landscape of medical innovation. The ability to utilize LVADs as destination therapy signals a shift from merely being a bridge to transplantation to providing definitive, long-term support for patients. This ongoing development offers significant hope for those facing advanced heart failure, illustrating how technological advancements are providing increasingly sophisticated and personalized solutions that can profoundly impact both survival and quality of life. Living well with heart failure, emotions and practicalities. Living with heart failure extends beyond managing physical symptoms. It encompasses navigating a complex emotional and practical landscape. The diagnosis itself can be a profound shock, and it is entirely normal for individuals to experience a range of emotions, including fear, anxiety, sadness, anger, confusion, or even depression, often collectively referred to as cardiac blues. It is crucial to recognize when these emotional responses become persistent or overwhelming, potentially indicating clinical depression or anxiety. Signs to watch for include prolonged sadness, feelings of emptiness or hopelessness, loss of interest in activities once enjoyed, persistent fatigue, sleep disturbances, difficulty falling asleep or waking too early, changes in appetite or weight, excessive worry, or physical symptoms like a racing heart or dizziness. If these feelings persist or significantly impact daily life, it is vital to inform the healthcare provider or care team. Psychological therapies, such as cognitive behavioral therapy, CBT, which explores the interplay between thoughts, behaviors, and emotions, along with antidepressant or anti-anxiety medications, can be highly effective in managing these emotional challenges. A strong support system plays a pivotal role in coping with heart failure. Maintaining strong relationships with loved ones provides invaluable emotional support and encouragement throughout the recovery journey. Open communication within the family, including acknowledging the crucial role of caregivers, is essential. Connecting with others who have similar experiences through heart support groups or cardiac rehabilitation programs can be immensely beneficial for emotional well-being and practical advice. These platforms offer a sense of community and shared understanding. Empowering individuals to actively participate in their self-care is fundamental. Daily weight checks remain a critical self-management tool. Individuals should weigh themselves at the same time each day. Example, in the morning after using the restroom and before eating or drinking, using the same scale on a hard, flat surface. Promptly reporting any sudden weight changes to the healthcare provider is crucial, as this can signal fluid retention and worsening heart failure. Maintaining a daily symptom record helps individuals understand their normal baseline and identify any changes or worsening, enabling early reporting to the doctor and potentially preventing hospitalization. Taking all prescribed medications exactly as directed is paramount. Understanding the purpose of each medication and being aware of potential side effects, while discussing any concerns with the healthcare provider, ensures optimal treatment effectiveness. Attending all scheduled follow-up appointments with the healthcare team is essential for continuous monitoring of the condition and timely adjustments to the treatment plan. Openly discussing any impact of heart failure on work with employers can lead to practical solutions, such as part-time work arrangements. Addressing concerns about relationships and sexual health with the care team is also important, as these aspects of life can be affected by the condition or medications. The experience of living with heart failure extends beyond mere medical aspects. It imposes a significant emotional and psychological burden that can profoundly affect an individual's quality of life and their ability to adhere to treatment. Neglecting mental health challenges can indirectly undermine physical outcomes by impacting adherence to healthy routines and medical regimens. Therefore, effective heart failure management must integrate robust psychological and social support. It is not enough to treat only the heart. The whole person must be cared for, emphasizing the importance of a multidisciplinary care team and providing patients with access to mental health resources. Conclusion: the path forward. Living with heart failure is undoubtedly a challenging journey, but it is one that can be successfully navigated with proactive management and comprehensive support. While there is often no definitive cure for heart failure, it is an increasingly manageable condition, allowing many individuals to maintain a high quality of life. The power of proactive management, encompassing diligent lifestyle changes, adherence to prescribed medications, and, when necessary, advanced therapeutic interventions cannot be underestimated. Modern medical advancements and specialized self-management strategies offer significant improvements in symptom control, overall quality of life, and longevity for those with heart failure. The understanding that the body's initial compensatory mechanisms can mask disease progression for years underscores the importance of early detection and consistent monitoring, even in the absence of overt symptoms. Furthermore, recognizing the interconnectedness of various risk factors highlights the necessity of a holistic approach to prevention and treatment, where addressing one aspect can positively influence others. The progression of symptoms serves as a vital warning system, empowering individuals to seek timely medical attention and potentially prevent severe complications. The diagnostic journey, far from being a one-time event, provides continuous insights to guide and refine treatment plans. Moreover, the synergy between lifestyle adjustments and medication is crucial, with each component reinforcing the other to optimize outcomes. For those with advanced disease, the evolving landscape of sophisticated interventions, from ICDs and CRT to LVADs and heart transplantation, offers renewed hope and prospects for survival and well-being.